A call for equal access, the fight for COVID vaccines. In a powerful plea, Ella Halpern-Matthews, a historian from Kent, has shared her story, highlighting the urgent need for equitable access to the COVID vaccine. With a severe respiratory illness and a history of asthma, Ella's vulnerability to COVID and common colds is heightened, especially after having half her lung removed due to a cystic adenomatoid malformation. The eligibility dilemma. But here's where it gets controversial. Ella, like many others, was dropped from the NHS booster vaccine eligibility list earlier this year. Despite her chronic chest infections and the increased risk to her health, the health service updated its criteria, leaving her without the protection she desperately needs. Since then, Ella has contracted COVID 3 times, a stark reminder of the ongoing threat of the virus. Wearing a high-quality face mask and avoiding crowded spaces have not been enough to shield her from infection. The impact on daily life. Ella's health condition has not only affected her physically, but has also taken a toll on her mental well-being and social life. She shared her frustration, saying, "If I want to protect my health, I'm essentially forced to be a hermit and forego community and life in public." The social scene in the UK, she added, has become a challenging environment to navigate. With people reluctant to discuss COVID, testing, or canceling plans when unwell, Ella feels isolated and cut off from society, seeking support and awareness. In an effort to protect herself and her health, Ella has had difficult conversations with friends and loved ones, advocating for testing and mask wearing. She is now actively seeking new connections with like-minded individuals who share her COVID-conscious mindset. Eligibility criteria. A shifting landscape. According to the Green Book, the Guide for UK Health Professionals on Immunization, seasonal COVID-19 vaccination eligibility in England has changed. It is now limited to adults aged 75 and over, older adult care home residents, and those who are immunosuppressed. This is a significant shift from the autumn 2024 criteria, which included adults aged 65 to 74 and those in clinical risk groups aged 6 months and older. The immunosuppressed category, a narrow definition. Ms. Halpern-Matthews used to fall into the immunosuppressed category, but the NHS has tightened its criteria, now only applying to those on immune suppressant medication. Her last COVID jab was in 2022, and she has received a total of 8 vaccines since 2021, all free on the NHS. However, the Joint Committee on Vaccination and Immunization, JCVI, has stated that the Green Book's list of immunosuppressed individuals is not exhaustive and that clinical judgment should be applied to consider the risk of COVID-19 exacerbating any underlying diseases. Crowdfunding for health, a desperate measure. In a desperate attempt to access the vaccine, Ella has turned to crowdfunding, unable to afford the cost of a private provider. Vaccines in the UK are priced between £75 and £120 from independent pharmacies, a significant financial burden. She shared her frustration, saying, "Honestly, I'm broke. If I could afford to pay out of pocket, I would. But this situation highlights the dire state of affairs. You can get the COVID vaccine in France for under €10 and across the EU for even less." A two-tier health system. Ella's story sheds light on the two-tier health system in the UK, where those with financial means can access private health care and essential life-saving medicines, while others are left struggling to afford basic healthcare needs. Ella Halpern, chief executive of the Independent Pharmacies Association, IPA, described the NHS flu and COVID jab booking system as chaos. She highlighted the confusion surrounding eligibility and the aggressive responses from patients who were denied NHS COVID jabs. The IPA raised concerns in August when the JCVI announced its decision to exclude patients aged 65 to 74 who are not immunosuppressed. Ms. Halpern expressed worry about the potential spread of a new COVID strain and the impact of limited vaccination on public protection, especially given the high hospitalizations due to winter viruses last year. A call for action and discussion. Ella's story prompts us to reflect on the importance of equitable access to healthcare and the potential consequences of limited vaccination criteria. It raises questions about the balance between individual responsibility and systemic support. How can we ensure that vulnerable individuals like Ella receive the protection they need without facing financial barriers? What are your thoughts on this issue? Do you agree that equal access to healthcare, especially in the context of a global pandemic, is a fundamental right? Share your opinions, and let's spark a conversation about the future of healthcare accessibility.